Let's talk about hair loss, and I thought the best way to talk about this would probably be to go through various patient scenarios that I've come across over the past couple of decades and decide which one of these really fits what your experience with hair loss has been, and that way you can see if it speaks to you and decide how to approach your concerns. My name is Dr. Aram Elias. I'm a board-certified dermatologist. I've been in practice for almost 20 years and see the full spectrum of dermatology, from pediatrics to adults to cosmetic to surgical to laser and medical dermatology, everything in between. So I love to share my experience over the past 20 years. So subscribe now, follow along, and let's talk more about hair loss today. So this first scenario for hair loss is probably the most common one that I come across, and probably something most people have experienced at some point in their life, and it's what we refer to as telogen effluvium. Here's the classic scenario. You start to feel like there's an increased shedding of your hair and something that is not your normal. You notice that in the shower you're losing a lot of hair, there's excess hair filling the drain, there's hair all over your clothing. You find that when you brush your hair, it's like hair is filling the brush a lot more than it was before. Even though we define normal shedding as somewhere between 50 to 100 to even up to 200 hairs a day, it almost doesn't matter, because I do think our patients know what their normal is. And we know this because when something is not normal, patients start to collect their hair very often into little Ziploc bags for their daily hair shedding to show me, to designate what is not normal for them. So I don't get too caught up in if there's 50 hairs in that bag or 100 hairs in that bag, because it kind of doesn't matter. What those Ziploc bags tell me is, this isn't normal for you. You know this isn't normal for you, and you're scared and worried about what it could imply, and you want to be one step ahead of it because you don't want to lose your hair long term. So this is where understanding this type of hair loss is absolutely essential, because the stress of hair loss absolutely leads to more hair loss. And I find that understanding it and taking a step back to really reflect on why you're experiencing it can change the conversation, the tone of the conversation, and patients, when they feel reassured and understand what's occurring, can take a step back and not develop so much anxiety that it spirals out of control. So what's actually occurring? So normally, all other things being equal, we have hairs in the growth phase, we have hairs in the resting phase, and we have hairs in sort of an in-between phase. Normally, about the majority of our hairs are in the growth phase. So maybe about 80 to 90% of your hairs are in the active growth phase, and maybe 10 to 20% are in the resting phase. And this is kind of randomly occurring throughout your scalp. And that's that average normal hair loss that you experience on the day-to-day basis, is hair shifting from resting to growth phase and back again. And when they shift from growth phase to resting phase, a few months later, you might see that hair shed, because as it enters the growth phase again, a new hair pushes out the old one, and that resting hair that was sitting in the follicle gets pushed out, and there's a bit of out with the old, in with the new. That's happening all the time, and that's that standard shedding that you see on a day-to-day basis. Now, what's not normal? What ends up happening is, say for example, you have a major stress that occurs, and anything unfortunately qualifies as a stress. It can be physical, mental, emotional stress. It can be good stress. It can be bad stress. Anything that really puts a stress on your system can trigger a change in the growth cycles of your hair. So say for example, you bought a new home, or that you are studying for a major exam, say the SATs for our high school students, or the bar exam. Or say, for example, you had a major illness, you experienced the flu, or you experienced COVID, or that you had an operation. Or say, for example, you just had a baby, or postpartum. When that stress is experienced, then your body might shift cycle phases for your hair growth. So before, perhaps 80 to 90% of your hairs were in the active growth phase. Now perhaps maybe it's a lot less. Say for example, it could be 50 to 60% of your hairs in the active growth phase. That remainder, that difference, that 30 to 40% of hairs that used to be in the growth phase now enter the resting phase when the stress occurs. You won't actually experience hair loss at that moment, and that's what's really frustrating, because there's a disconnect between those windows of time. Now that there's a disconnect, that's where some of the confusion lies. So when the hair enters the resting phase, it doesn't immediately shed. There's a window of time where those hairs are pretty deeply rooted in the scalp and they won't fall out right away. However, after a few months, those hairs shift back into the growth phase, and as that new hair grows in, it pushes out the old hair, and that's when you actually witness or experience the hair loss. The shedding phase can actually be experienced 3 to 6 months after the major stress. Recognizing that there's a gap, there's a delay, can actually help a lot of people understand this a lot better, because the fear or frustration that a lot of my patients will have is simply that they'll feel as though there was nothing that happened, there was nothing that they could identify right before it occurred, and actually thinking back over the past year can change the way they see it then. So now you're in that shedding phase where hairs are starting to fall out. A lot of times if you stretch the hair out and look at the end of the hair, you'll see a little white bulb at the end of the hair that tells us it's what we refer to as a telogen hair, meaning it's being shed right from the root. Before understanding that, a lot of my patients will feel as though, oh my gosh, it's coming out at the root. This is really devastating. But when you understand that it's only because that hair was no longer growing and there was a new hair pushing it out, that can really help understand the process a little bit better. Ironically, of course, when patients come in to see me during that shedding phase, it's always worthy of me pointing out that this is technically the recovery phase. The hairs that had stopped growing before a few months ago have now already re-entered the regrowth cycle, and now you're seeing that happen where those hairs are pushing out the old ones then. That's when I really take the time to really examine the patient's scalp, because when we look very closely at the scalp, what you'll notice is that there's hairs growing, but they are fine hairs. They're peach fuzz. They're often light or white in color, because hair, when they first grow, they grow like a blade of grass where they're tapered at the end, and they're harder to really appreciate. And this can be really frustrating, because unless we can identify and see that, patients get really scared. It's a very vulnerable time for a lot of people. Hair is a very personal thing, and when you see that it's shedding, it can only provoke a lot of anxiety. And I find taking that time to really examine their scalp and find evidence of that growth can really help navigate that window of time. Now, is there anything that you can do to accelerate the growth phase for telogen effluvium? And this one's a little bit tougher to talk about, in the sense that there's nothing great for this. It is true that sometimes temporarily using Rogaine or minoxidil can help, which is over the counter as a hair growth formula. Perhaps could accelerate the re-entry of those hair follicles into the growth phase, and maybe even potentially widen the barrel of each individual hair a little bit faster. It doesn't necessarily have to be used forever, because remember, this would be an off-label usage of minoxidil topically. So it is something to consider, but before you do so, I'd always advise talking to your dermatologist to evaluate your scalp first and rule out other causes, because we wouldn't want to waste time if there is something else that needs to be treated or addressed. A lot of my patients that enter into telogen effluvium will start to feel a fear of washing, brushing, or manipulating their hair. They'll say to me that they haven't washed it in days, because every time they wash it, they'll see so much volume loss. I do try to encourage my patients to understand that the hairs that are coming out were going to come out anyway. Whether they came out of the shower, shed on your clothing, or in your hairbrush, it was going to happen, because new hairs are growing in behind it. Those hairs were going to come out anyway, only because there's a new hair growing in that pushed out the old, and we almost need that to occur to some extent to make space for those new hairs to grow in. That window of time that ensues afterwards, though, is very frustrating, because it's a lengthy window of time that can last 6 months to a year before you fully appreciate some improvement in your hair growth. And it's because time alone is responsible for growing those hairs longer. As the hair grows longer, it grows like a blade of grass, where it starts off tapered on the end and widens as it gets longer, because the barrel thickens as it gets longer then too. Now, is there anything that you can do to accelerate this phase? So I think the most important thing is to first talk to your dermatologist and have an evaluation of your scalp, where we look to see, is there new growth occurring, and what we'd expect to see. If we do see evidence of this, as well as no other underlying triggers that triggered it in the first place that need to be treated or addressed, then we might be in good shape to wait and watch. However, I would not want you to ignore the possibility that the stress that occurred on your system that triggered the hair loss in the first place, if there was still something present, say a change in your thyroid hormone or you're anemic, or some other stress that hasn't been directly addressed, we should evaluate you first to decide if there's any reversible causes of hair loss that we can identify. The most important thing before you see your dermatologist or your primary care doctor with hair loss is to not start on an over-the-counter supplement for skin, hair, or nails, only because many of these will have biotin in them. The problem with the biotin is, one, is it probably will not help with your hair growth as much as you'd like it to, but the other big challenge with biotin is it interferes with our laboratory assays for conditions we're screening you for to ensure that you don't have any reversible causes of hair loss. So if you came to me and said, I'm not only experiencing hair loss, but I'm also feeling tired, fatigued, and gaining weight, I just feel like I'm sluggish, and say I wanted to check your thyroid function test and to make sure you weren't anemic at all, if you have been on biotin and didn't tell me that, it actually would affect your blood work results in a way that makes it harder for me to interpret if you have a reversible cause of hair loss. And the biotin's not going to help that. It's only going to make it complicated, in that we might misdiagnose or miss a diagnosis of hypo or hyperthyroidism. So we want to make sure you're avoiding those supplements so we can evaluate you cleanly and then decide what steps to take and what supplements may work for you. And it may or may not be biotin, depending on if you have a biotin deficiency. I find that the key steps in evaluating any patient with hair loss that every one of us is inclined to want to know is, one, what is causing it? Why is this even occurring? Because identifying the why helps people understand it so much more effectively, because of course our minds run wild with all the possibilities, and so do Google searches, where Google is not a bad thing, but the problem is if you don't know the words to Google, you may not find the right diagnosis. So it's really understanding all the different scenarios that are out there that trigger hair loss in the first place, so that we can identify, define them, and decide how to approach management and treatment options. The second important thing that every patient with hair loss should do is to see their dermatologist, because understanding what's happening, discussing it with your dermatologist, and having a very close exam of your scalp to evaluate the presence or absence of what we call follicular openings and the stage of development of your hair can really help us define what's occurring. We have to decide and make sure that there's no inflammatory causes of your hair loss, anything that does designate a reason for us to treat any underlying conditions. By doing so, you can only get better results out of your hair regrowth plan. You can also avoid spending lots of unnecessary wasted money on hair growth serums, products, supplements, things that may or may not be so good for your hair or you in particular. So we just like to make sure that we give you an appropriate evaluation so you can decide what makes the most sense in terms of intervention.